India, we are in a very unique situation. We are really facing what we call an epidemic of cancer. The numbers of the cancer patients that we see in all centers in India seem to be very high. I'll give you some data. So every year, currently it is estimated that 10 lakhs of patients are diagnosed to have cancer in India. Out of that, 5.3 lakhs are known to be women, and 4.7 lakhs per year are men are diagnosed as cancer. Unfortunately, most of them get diagnosed at a late stage. And the other, most difficult part of the fact is that the numbers are increasing. Over the past 10 years, it is understood that the numbers have literally doubled. So, in the near foreseeable future, we are really facing a very large problem, and we can call it as an epidemic of cancer. In India, we know that there are certain unique aspects with regard to the incidence and also the distribution of cancer. I have already mentioned that large number of patients are getting diagnosed. What we also see is that they are getting diagnosed at a relatively younger age. The incidence of cancer is from age 30 to 69 seems to be the biggest burden in our country, as compared to most developed nations wherein these cancers are seen at a relatively older age group. So, the cancer burden hits the most productive population in our country, the working class of people. And we also see a very high incidence of cancer in the younger age group, like the children and adolescents. 15% of our patients are children and adolescents, which are completely unlike what is the situation in a developed country. In a developed country, typically about 1 to 2% of all the cancers are in the children and adolescent age group, whereas in India it is 15% in this subset of people. The other thing that we see sadly in India is that most of them come at late stages. It is estimated that 70% or 80% of the patients are diagnosed in late stages in India. We have already said that every year nearly 10 lakhs of people are getting diagnosed to have cancer in India, out of which 70% of them are lost in the first year. So, very high mortality in the first year itself, because they are getting diagnosed at late stages, which is a very sad fact. If only the situation can be reversed, and if these patients can be diagnosed at a relatively early stage, there is a possibility that a large proportion of these patients can be saved. See, the cancer burden in India is to be understood with all its peculiarities and nuances. We spoke about the high numbers, and we spoke about the relatively younger age group, and we also spoke about the late stage of diagnosis and a huge loss in the first year itself and a very high mortality rate. We also understand that the cancer burden within the country itself is different in the different parts of the country. You can call it as a cancer map, which is unlike the geographic or political map of India. You can say that the cancer map of India is unique. If you take the northern part of India and the northeastern part of India, the incidence of cancer and the type of cancer seen there is different from the incidence and the type of cancer prevalent in the southern part of India. So, you can understand that in different parts of the country, some type of cancers are diagnosed in large numbers. This is probably related to the the food, ethnicity, and the lifestyle. And so, within the country itself, there is a very heterogeneous distribution of the cancer burden. So, this has to be understood. And as I have told, our economic challenges are totally different, and we unfortunately diagnose most of our patients in late stages. And therefore, the per capita expenditure on individual patients seems to be higher. If only you can diagnose them at an early stage, the treatment options would be simpler. So, the economic burden and the challenge is totally different in our country, and the distribution is different. So you need to be aware of the various special aspects of cancer in our country when we try to find a broad solution to our problems. We fully understand that the volume is very big or very high, and we have already talked about the rising incidence of cancers in our country. The most the direct recommendation could only be that the awareness should increase, and every possible media or every possible part of the society, like the print media or the telemedias or the other educational portals, or including schools, colleges and universities, can all play a part. If only the awareness can be increased, and if these patients somehow come to attention early, and they come for screening, say, and they have a very good opportunity to get diagnosed at an early stage, then the cure rate can be very high. It is estimated that if only the entire population can be screened, and the entire number of cancers, whatever is happening in our country, can be detected at an early stage, we can convert these incurable situation into 80% cure rate, so which will be a big impact in our country. Similarly, we can also talk to our people and educate them about some of the important lifestyle modification. I would just like to quote one important lifestyle aspect. It is fully known that tobacco is one of the biggest impact factor. Tobacco causes a huge burden, one of them being cancer. Of course, it also affects cardiac and pulmonary status, and it leads to a lot of cardiac and pulmonary morbidity. But talking about cancer itself, if only tobacco in its various forms, the smoking and the chewing tobacco, chewing tobacco is very peculiar to our country. If only that can be eliminated, there will be once again a huge impact in the incidence of cancer as far as the lifestyle related cancer goes, habit related cancer goes. Fortunately, as we understand that the disease burden is going up and up, fortunately the technology is trying to catch up, and a lot of these technological advances are beginning to be available in our country. And I would say that most major centers across the country, in all the major cities, are already well equipped, and they have well trained personnel, and they have very good infrastructure comparable to any good center in the West. The important advances that have happened in the field of cancer can be then talked about in the various interventions that we have to offer. We can talk about advances in the surgical field, we can talk about advances in the field of radiation oncology, and we can talk about the advances in the field of medical oncology, and also in the diagnostic aspect. We have very exciting developments that have happened in the surgical oncology. Now we have more and more minimalistic surgery. We have robotic surgery come in and establishing itself in many different indications for surgery. And with regard to the radiation oncology, now more and more high precision radiation oncology is the new exciting thing that's happening. People have now are now completely aware of, and they are doing more and more high precision radiation, like intensity modulated radiation, like what we call image guided radiation, and now even more exciting thing like stereotactic radiotherapy, and what they call it as Cyberknife, and they have Gamma knife, and they have Cyberknife. All these are ongoing and continuous efforts to be more precise in the delivery of radiation with less morbidity and less toxicity to the patient. One other important development that's going to happen, one other improvement, is the advent of proton therapy. Proton therapy is already established in the Western world, at least in the United States of America and few European centers. And we are also looking forward to establishing our own proton therapy center in the very near future, which is probably the first in the Asian country, and which will be again a big advance in the field of radiation oncology. Similarly, in the field of medical oncology, a lot of newer drugs have come in, and there is an explosion of what we call targeted drugs, targeted therapy and targeted therapeutic drugs, which have completely changed the way the treatment aspect is looked at in cancer. The targeted therapeutic drugs have very high specificity when they treat the cancers. They act on the unique mechanism of each cancers. They try to act on at the genetic level, and therefore their efficacy is very high and their toxicity is much less when you compare to the conventional chemotherapeutic drugs or the chemical drugs, and the response rates are good and the long term survivals are much better already with the advent of targeted drug therapies. Similarly, in the field of diagnostics, now we have most centers now have PET CT scans, and even when the PET CT scan now the newer advance is to have dual tracers, and we have very high end MRIs. Now we have the fusion of the CT and the PET, and now we have the fusion of the MRI and the PET, and we have imaging services. We have scopies that are the scopies integrated with imaging. All these have improved the diagnostics, and the molecular biology and the pathology has also refined, which has also improved the diagnostic precision of these cancers. Skill gap is a really worrisome aspect in healthcare scenario in India. While we talk about the rising incidence and the huge cancer burden now and in the foreseeable future in our country, unfortunately, the trained manpower, namely the physician and the oncologist and the nurses who are able to look after these oncology patients, are not keeping matching the demand, the number of patients versus the number of doctors looking after the patient. The ratio is very poor when you compare to the Western world. Just to give you an idea, if I can say that there is one oncologist or oncology trained physician to look after 250 cancer patients in the Western world, one can state that the number is almost 10 times one doctor per 2,500 or 3,000 patient population in this country, and this deficit is going to only increase in the next decade because the training and the number of centers to train and these physicians and the nurses to come out is not going to match the number of patients that are going to come. So the skill gap is going to only widen. So that's a very worrisome factor which needs immediate attention at all levels, including administrative and governmental levels. See, our center was established as the first standalone cancer unit among the Apollo Hospital group. As you are aware, Apollo hospitals were established 30 years ago, and now there are many Apollo hospitals across the country in many cities. Among all of them, this center in Chennai was the first one to be conceived as the first standalone comprehensive cancer hospital among the Apollo group. But now we already have comprehensive cancer care centers in nearly 10 cities across the country among the Apollo group. By comprehensive cancer care, I mean there is an integrated medical oncology, surgical oncology, radiation oncology, and radiology services, and pathological services which are completely dedicated to cancer, and they all work as an integrated unit. So this kind of setup is the necessity need in our country, and this center was established 20 years ago, and now this is one of the largest cancer care provider in our country, in the corporate world. For example, last year, we ended up diagnosing our patient population was, we were managing around 60,000 patient population as an outpatient load, in a single center, which is very high. And this center has all the state-of-art facilities, whatever we have discussed earlier. It has got one of the best radiation oncology setup. We have the country's first Cyberknife facility. We were the first center to do the intensity modulated radiation in the country, and then we were probably one of the earliest center to take up stereotactic radiotherapy, and we were the first center to establish the Cyberknife radiation, and we probably will be the first center in the entire Asia to have the Proton therapy facility. This is as far as the radiation goes. Among the surgical oncology, state of art, best equipped theaters. We have integrated diagnostic services along with the theater, and we have one of the best equipped robotic surgery facility in the country, and with the largest experience of robotic surgery in our country, probably from this center. With regard to medical oncology, it's a well supported service, and the state of art systemic therapies, salvages, all the targeted drugs are all available here. We also have an integrated, we have a hematology unit which takes care of leukemias, and we also have one of the largest bone marrow transplant center in the country, in the corporate sector. We have already done more than 700 bone marrow transplants over the past 15 years, and we have a fantastic radiology support structure. We have the PET CT scan, we have the MRIs, and we also have one of the best pathology and molecular support structure. So it's a very well provided, very comprehensive cancer hospital. So medical tourism is an important aspect for the healthcare industry. But what I can say is that we take care of patients from not only from this country, from different parts of this country. We also now, are taking care of patients from Middle East and from the African countries. We get patients from many countries in Africa, like Nigeria, Tanzania, and we are getting patients from Zimbabwe, and we are now getting patients even from South Africa and Kenya, apart from many Middle East countries. We also get patients from the entire SAARC region. We get patients from Burma, Bangladesh, to Nepal, to Sri Lanka, to sometimes from Pakistan, and we also get patients from Malaysia, and also sometimes from Singapore. Apart from this, we also get some patients from the European countries, and recently we have got opportunity to look after patients from Ukraine and the erstwhile Russian Federation. So we are happy to provide services to these patients, because it tells us two things. A, they recognize our capabilities. B, we are happy to help our country in some way, that we are able to take care of patients from different parts of the world.